Mullenix received her BS degree from Truman State University. Her PhD was in pharmacology from the University of Kansas Medical Center, and her postdoctoral training in environmental medicine from the Johns Hopkins School of Hygiene and Public Health. Please welcome Phyllis Mullenix.
As I said, it's a pleasure being here. This is my third time speaking with you on my favorite subject of fluoride. I have had an opportunity with my misfortunes, I guess if you would call it that, with publishing a paper saying that fluoride is neurotoxic. A lot has happened since those days, and I actually am quite pleased with the direction that I'm taking. I no longer work with animals. I'm interested only in effects in humans, and I am trying to help individuals that have suffered chronic fluoride poisoning. So I'm here today to talk about the problems of diagnosing and treating chronic fluoride poisoning. One of the first things that you have, years ago, in 1975, the Handbook of Legal Medicine admitted that sodium fluoride in the form of rat poison or roach powder is in such widespread use that it is surprising that there are not more reported instances of poisoning by this substance. The fact that fluoride is probably more likely to be missed in a routine toxicological analysis than any other inorganic substance may account for the apparent rarity of this type of poisoning. The situation is, he was talking about acute fluoride poisoning, not chronic. And in acute, which is a lot easier to recognize than chronic fluoride poisoning, they weren't even looking for that. So if you're not looking for problems with acute fluoride poisoning, how on earth can you go in to diagnose chronic fluoride poisoning? The diagnosis of chronic fluoride poisoning in the U.S., I call it the 3D diagnosis. First of all, the first D is dismiss dental fluorosis as a cosmetic effect. So most of the dental communities, public health, they consider dental fluorosis a cosmetic effect, so there's really no need to worry about treatment or if it's a cosmetic effect, so you can make the teeth pretty and ignore it. The next D is deny. Deny the existence of soft tissue effects, meaning deny the existence that it affects the brain or the thyroid or the kidney or any other tissue besides mineralized tissue. And then distort, the final D of diagnosis. The way it's been done in the past, they've distorted the bone effects as osteosclerosis only. And osteosclerosis is the favorite benchmark that industry tries to use as being the only outcome that is important in chronic fluoride poisoning. And they use a simple test like X-rays, as you see here, and where the hyperdense of the bones will show or indicate osteosclerosis. The problem is, chronic fluoride poisoning, even effects on the bones, is not just osteosclerosis. It's a metabolic bone disease. It affects soft tissues. It affects a lot of things. And so they focus you on osteosclerosis, which is very difficult to get and happens relatively rarely. And that's why they've used it as an excuse to say that chronic fluoride poisoning doesn't happen in the United States. So metabolic bone diseases with osteoporosis, stress fractures, skeletal deformities, osteomalacia, arthritis, they don't consider a part of chronic fluoride poisoning. I'd like to go back in the timeline, and as you probably remember, I've gone back in that timeline because of my experience with Harold Hodge and him being in my department. So I've been interested, and I've gone back and gone back and gone back to try and look at the development over the time. And I want to start here. You all know about the ADA, but I wanted to bring you forward with the AMA. and what they've been doing over the years, and compare it in the timeline with what Harold Hodge knew and when did he know it.
Dr. Harold Hodge, a distinguished toxicologist on the Rochester team, has investigated the safety of fluoridation.
Starting in 1943, the AMA said that fluorides are general protoplasmic poisons. The enzymes that they said were affected, they had a whole list of them that inhibited the esterases, phosphatases. There's a whole list of enzymes that they knew that fluoride would inhibit. And there were also other enzymes that it would stimulate. But going on, in 1944 came the peach crop litigation, and I'm sure you've heard of that if you've read Christopher Bryson's book. But it was a litigation that basically turned the heel around with respect to what they how they deal with fluoride and fluoridation. At that time, and the Journal of the American Dental Association was saying in 44 that 1.2 to 3 parts per million fluoride in drinking water caused osteosclerosis, spondylosis, osteopetrosis, goiter, and that the risk was too great to fluoridate water, just to prevent dental disfigurements among children. 1944 to 1950, though, both the ADA and the U.S. Public Health Service turned around and they endorsed water fluoridation.
Fortunately, some years ago, it was found that fluorine in the drinking water had a considerable effect in reducing dental decay. And many cities in the United States, such as San Francisco, Cleveland, and Buffalo, have added fluorine to the drinking water. And others are doing it to the extent that about 1/5 of the people in the United States now have the benefit of this addition.
So in less than a period of a year there, they went from completely saying that fluoride was a protoplasmic poison and that it caused all of these other effects, that it was too great you couldn't fluoridate the water. Now Hodge at this time, in the 1946 to be specific, in declassified documents, he knew a little secret from working with humans in factories that were being exposed to fluoride. He knew that fluoride effects were enhanced by metals, but they didn't publicize that information. So just tuck that little timeline there, back in 1946 that Hodge knew this. 1945, of course, started the 10 to 15-year fluoridation experiment in Newburgh, Grand Rapids, and Ontario. To carry it forward then, in 1955, I'm going to go forward up to 2000, where the American Medical Association and how they came along during this time. In 1955, the AMA's policy was that they had no comment on the safety of fluoridation. They relied on the ADA and the U.S. Public Health Service. So basically, they were hands-off. They were letting the dental community to take the lead on fluoridation. In 1958, they said no guarantee of safety for fluoridation and that they were doing no investigation as to the side effects or any complaints of there being a problem. In 1965, the American Medical Association actually turned around a bit and endorsed the principle of fluoridation, but they still wouldn't come across with any safety claims, and that they wouldn't talk about any investigation of any of the side effects. So the AMA was still silent and lurking in the background. Meanwhile, Hodge was very busy at coming out with his publications, and he was very busy trying to disassociate acute toxicity mechanisms, meaning inhibition of glycolytic enzymes, shock, mild renal pathology, calcium binding, and acute and chronic mechanisms. He was trying to convince everybody that acute fluoride toxicity is a very different animal than chronic fluoride toxicity. And the reason that he had to disassociate that is because at that time, remember, we had a lot of nerve gases that were being used. And fluoride, of course, is used in making of nerve gases, and they are anticholinesterase agents, and they have very distinct signs and symptoms of fluoride poisoning. The sweating, the confusion, it's a complete blocking of the cholinergic system. And so he was quite anxious because publicly he didn't want chronic fluoride poisoning associated with the very well-known and very public acute toxicity problems of nerve gases. So, but then something happened in 1982 and 1983. There was a complete turnaround. It was quiet among the medical people, but Sternweiss and Gilman, he linked the aluminum and beryllium fluoride complexes to cell receptors. Now, Hodge had to have known this because in one of his publications, he actually stated that cyclic AMP production by low levels of fluoride were actually increased. He said that fluoride was twice as potent as glucagon, the hormone glucagon. He also said that fluoride was more active than adrenocorticotropic hormone in fat cells. He said, this deserves thought. But he didn't say anything further, and it was in 1982 and 1983 that I became associated with him. And so with his mindset, he says, the neurochemists are very interested in the fact that fluoride is more potent than some of our endogenous hormones. And so he said, well, that deserves thought. But did he say anything publicly? No. Did the American Medical Association between 1982 and 2000, they started, in fact, reversing. Remember, they were in the corner in the back and letting the dental community go out forward with it? Well, in 2000, they were all of a sudden urging physicians to correct the problem of people not getting enough fluoride. So they completely reversed their positions, and they said, go out and make the correction, make sure that the public is getting enough fluoride and that they're not getting exposed to suboptimal levels of fluoride. So here's the timeline. There's a very big reversal here, the American Medical Association, and there's Hodge in 82 and 83 saying, neurochemists are interested in this hormone link, and what does this have, this deserves thought. Of course he was thinking about this because he knew in his work with the War Department and studying fluoride that if you combine fluoride with metallic salts and you compare the response in a dose-response curve of fluoride alone with fluoride and metallic salts, and this was in documents that were dated in 1945 or 1946, they knew that both the effects on the lung and the skin were enhanced if fluoride coexisted with metals like beryllium. And they, in fact, knew they had human evidence that the effects in the fluoride were greater than beryllium, and they knew that ammonium beryllium fluoride, their effects were greater than simple fluoride compounds. There was animal data. He also did animal studies showing that fluoride beryllium compounds enhanced pulmonary toxicity, and it did more than that. When you combine the metal with the fluoride, it caused a greater deposition of fluoride in teeth and bones compared to fluoride alone. So when Sternweiss and Gilman in 82 said that they linked aluminum and fluoride and beryllium and fluoride and linked it with cell receptors, he knew privately that yes, there is something going on between fluoride and hooking it with metals, and it completely changes the whole situation. So that the public image, though, that he came out with, they said that in vitro enzyme effects of fluoride were seen at millimolar concentration levels and that they were irrelevant to in vivo toxicity. That's what Hodge You know, he fostered that knowledge, he fostered that impression, but secretly he knew that you combine fluoride with metals and you're talking about a different dose-response curve altogether. We have to look at chronic fluoride poisoning as completely as a receptor disease. You have to consider the dose-response curve. And the first thing you have to do, the dental community and the public health, I don't want to put just on the dental community, has to understand first the difference between concentration versus dose. The concentration is milligrams fluoride per liter of water. It could be parts per million, parts per trillion, parts per billion. But that just tells you nothing about dose or how much is taken into the body. That's based on milligrams per day or milligrams per kilogram per day. The thing is, just because you talk about and give a concentration, there is no control of the consumption. So you have no idea of what the dose is. So these inane comments out of CDC that 1 part per million in the drinking water will give about 2 milligrams fluoride ingested per day, and they say fluoridation delivers a small and controlled dose of fluoride. Hello? Before you can know what the dose is, you got to know how much somebody drinks. The fluoride dose delivered is safe, it's no toxicity, and effective at reducing cavities for all consumers. The susceptible populations is important because this whole dose responds because you don't know where in that dose response curve that those sensitive populations are. Individuals with the impaired kidneys, cardiovascular function, diabetes, individuals with compromised immune systems and osteoporosis, individuals with deficiencies of calcium, magnesium, or vitamin C, and the elderly and children. Why are children so considered susceptible? Fluoride readily crosses the placenta, allowing an in utero exposure. There are developmental vulnerable periods where those G protein coupled receptors, and all of those receptors are very important, in particular for brain development, and brain and bone development. Immature blood-brain barrier enhances penetration of the CNS. And children, especially less than 2 years, have poorly developed swallowing reflexes. And on a per body weight basis, children have 3 to 4 times greater fluoride exposure than do adults. Children less than 6 months old have skin 30% thinner. They should not be exposed. Here's one case study that in showing this whole thing. 1988, this young child was started giving sodium fluoride supplements, so 1 milligram per day. She was 2 3/4 years old. 1990, she started with the rashes, the lip sores, the flesh tone papules on the face. 1991, she had dry skin. It was thought to be probably contact dermatitis. Teacher reports of learning problems. 1993, the sodium fluoride was actually stopped, but she was too late. She already had dental fluorosis. 7 years later, she was well known to have menstrual irregularities, rashes, nausea, vomiting, fatigue. 2004, she had the nausea, vomiting continued. 2005, she was diagnosed with osteosarcoma. 2006, it metastasized to the lung. 2007, she died. All of that, and a lot of hormone changes in there, and it led to growth hormone. All of that is through fluoride and impacting. Here's another case report, a water treatment operator.
My name is Joe Walls. I'm from Sardis, Arkansas. I am a water operator and a sewer operator. I was injured on the job in 1997. I was sprayed by hydrofluoric acid, or fluoride. I was trying to work on a pump and the pressure didn't depressurize, so when I did it, unhooked the pump from the line, it sprayed acid all over me. So I've had lots of health problems since that time. They started within about 3 or 4 days and got progressively worse over time.
His problems, he got lesions all over the skin. His medical records, he had cardiac arrhythmias, T-wave inversion, fluctuating cardiac panels, anemia, pericarditis, clotting changes, and you can see the marks on his abdomen. He had gastrointestinal signs, he had the enzymes, the triglycerides, the glucose, everything was off, the liver function enzymes, the neurological problems. He had, his testosterone was down, he had chronic pains, paresthesias, arthralgias, myalgias, headaches, the whole thing. Today, the diagnosis and treatment of chronic fluoride poisoning has produced actually a clash of the industries. The fluoridation industry and the pharmaceutical industry. They both have got their heads in the sand when it comes to fluoride. Why is the fluoridation perspective got this ostrich approach? Because they think that the total fluoride intake is just 2 milligrams a day from water fluoridation only. They look at it as one piece of the pie. The NRC 2006 has estimated that our daily intake is based on our toothpaste, food, pesticides, and air is between 0.8 and 11.5 milligrams daily, way over the level that's going to cause the impact. They don't realize that pesticides, water fluoridation, pharmaceuticals, workplace, all of these are giving us fluoride exposures. The total fluoride intake is still unknown. We inhale it, we consume it, and we drink it in water. The skin absorbs it, our bodies store it, and it hangs around for 20 years. We excrete it in the urine, the feces, and the sweat. And in fact, since I've tracked it in the Poison Control Center data from 1989 to 2005, the exposures to fluoride for children have been increasing all the way up, and of those exposures, we've been regularly causing adverse medical outcomes in a little over 3,000 children every single year. And yet, the fluoridation perspective, they keep putting out the same old propaganda. Fluoride is naturally occurring, it's nutrient, it's essential to the teeth, benefits all, it's safe and effective, and one of the great public health achievements of the 20th century. And they've even said that the chemical additives used in fluoridation delivers fluoride where we don't have to worry about the contaminants. And with those three chemicals, hydrofluorosilicic acid, sodium fluoride, or sodium fluorosilicate. The problem is we get those chemicals from places like Mexico. That's where our hydrofluorosilicic acid is coming. And we've actually analyzed some samples of that hydrofluorosilicic acid. Here's the metals that we found, and here's the levels. Aluminum, these are all in parts per million. This was done by a certified analysis laboratory in New Jersey. Look at the arsenic levels that we're putting in just by putting hydrofluorosilicic acid into the water. There's arsenic and barium and cadmium and manganese, and in this particular sample there was lead. So, you know, fluoride is not this perfect substance that's clean, that's being put into the water. And here are the salts. The salts come in, there's not a single salt fluoride chemical that's produced in the United States. We get all of it from China. And you know what China is like in terms of contaminants and the products that's been sent into this country. We analyze these systems and look at the amount of aluminum. 3,000 to almost 4,000 parts per million of aluminum that's in those salts that they're fluoridating some water. The biggest problem was that the amount of aluminum, the very thing that fluoride likes to combine with and cause an effect. In other words, whether it's hydrofluorosilicic acid or the salts, fluoride additives are like a box of chocolates. You never know exactly what you're going to get. You're going to get arsenic, you're going to get aluminum, you're going to get barium, you're going to get iodide, you're going to get chromium, you're going to get a whole lot of aluminum. The pharmaceutical perspective isn't much better. All they've done for years, they've stuck their head in the sand from a different perspective. They said ditto the fluoridation perspective. So all the problems that the fluoridation had their heads in the sand is the same true for the pharmaceutical companies. They have no clue as to the treatment for chronic fluoride poisoning, and yet they've used metal fluoride complexes for decades to explain receptor function. So receptor function is the basis of today's drug development. It's a win-win situation. Let the dentist put the fluoride into the drinking water. We're going to make the drugs that are going to take care of the symptoms caused by the fluoride in the drinking water in the first place. So the situation demands that we got to get our ducks in a row. You've got the pharmaceutical industry on one hand, and they're contributing parts per trillion, parts per million levels of all of these drugs in our drinking water. But they can say that the benefit is life-saving to have these drugs. So you can't take the drugs away. It's portrayed as risky drug waters, though. And so there's going to be a liability question that the pharmaceutical companies are going to have to answer to. But they're going to turn around and they're going to point a finger at those who push fluoridation, because these levels of these drugs are in the part per trillion to part per million range at the most, whereas fluoride, the drug that was intentionally added by the dental community, was, they said, and it was just to benefit the teeth, and it was supposed to be safe and effective, and the liability was pushed to the states. So the problem is, you got this clash of the industries. Considering fluoridation, all you should think of is remember the alchemist. As you add fluoride with toxic contaminants daily to the drinking water. Water that is also contaminated with potent pharmaceuticals, and it's designed to hit the same receptors that are susceptible to fluoride. That is the qualifications to win you a Darwin Award, a disastrous scheme that is astoundingly idiotic. Well, here's what happened to me when I stood between the shoulders of giants. Harold Hodge on one side, who, of course, started the fluoridation, Jack Hine on the other, who was responsible for putting fluoride in toothpaste in the first place. This is what gave me and made me today. I'm educated, I'm experienced, and I'm jobless. I learned that the Harvard motto is Veritas, which is Latin for truth, and that's the Harvard way of, making me realize that the truth shall set you free. That's the Harvard way of saying you're fired. At Harvard, the workplace safety, they said, oh, well, we can offer you workplace safety. This is their idea of workplace safety. Like the guy who had to actually hold up the target at a military shooting. And what has it got me? When I go in and talk about fluoride, I'm known as the X-File lady, and that's the way I'm introduced. So this is one X-File lady saying goodnight.